Paul Marshall. I'm one of the owners of Coastal Physiotherapy in Maroochydore. What we're going to do today is talk about a technique called soft tissue release. It's a technique we specialise here at Coastal Physiotherapy. It's a dynamic yet highly effective way of treating joint and muscle pain. What we're going to look at first of all is treating through the neck. Our patient here has got some upper neck tightness from working long hours at a computer. So what I'm going to get you to do, Nicole, is just to come up the bed for me a little bit. Keep coming up until your shoulders are all the way at the top of the bed and just relax there. So this technique focuses on our muscles. What we're going to be doing is doing some manual work on the muscle, some gentle massage work. Then as we're massaging the muscle, we're just going to gently start to stretch the muscle out. So what this technique allows us to do is to feel how the muscle feels as we start to stretch the muscle. The resistance of a muscle to that movement is very important in really uncovering the health of that muscle. How's that feel, Nicole?
Yeah, good.
So what we're not doing at any time here is moving beyond where the patient is comfortable. We're not applying any more pressure than is comfortable, so it's a very gentle technique, yet very effective at helping that muscle relax and grow longer. And as that muscle starts to release, the patient's going to feel more comfortable as we take the pressure off the joints of the neck. This technique is effective in all areas of the body, so we use this from neck, lower back, shoulder problems, elbows, knees, ankles. Basically anywhere you've got pain, we can do some soft tissue release. One of the other advantages of this technique is through the treatment we can really uncover exactly where the patient is tight. That means we can then be very specific in how we get the patient exercising at home. So we can give you specific stretches which can help to loosen that area up. And then as the treatment progresses, we can look to strengthen certain areas to prevent recurrence of the problem. Also, one of our jobs as physiotherapists is to identify what may be causing the problem. So with people who are working at computers, it's important that we find out if there's problems there in the way that the person's sitting at the desk or the way their workstation is set up. We can also then work closely with our occupational therapist if an assessment is needed within the person's workplace to have a closer look at issues that may be taking place there. Often patients with neck pain may feel symptoms down into their arms, so they may get things like numbness, pins and needles, radiating anywhere from just to the tip of the shoulder, but they can go down past the elbow into the fingers. This technique is also very helpful in relief of those conditions. Symptoms down the arm are often caused by irritation of the nerves as they leave the neck. So by freeing off that area, so loosening off where the nerve leaves the neck and passes down the arm, we can help relieve the symptoms down the arm. It's a very safe technique for that. What we're not doing is performing any manipulation around the neck. In a manipulation, you're moving the joints beyond where they naturally move. With this technique, we're just moving as far as the patient can comfortably and then returning back to the neutral position. Through the repetition of the movement, the muscle is gradually going to release. So we'll gradually move more and more through the course of the treatment, but at each stage only moving as far as the patient can comfortably tolerate. One of the advantages of treating necks in this position is it allows us exposure to the whole of the neck. When you're sort of treating the neck with a patient lying on the front, it's very hard to get to the muscles around the front of the neck. Muscles around the front of the neck also get very tight and can also cause pain up into the edge of the jaw. So in this position we can work nicely up into that angle there, right into the joint between the neck and the skull. So hopefully you can see there that we've started to really loosen up, particularly through the muscle here, which is the upper trapezius muscle. We're really starting to increase that movement there. How's that feel, Nicole? Patients will often notice some benefit from treatment, even after the first treatment, whether that's reduced pain or increased movement. After 3 or 4 treatments, there should be significant gains. Particularly with working on their exercise at home, patients can really make significant ground with very few treatments. We try and encourage as much self-management as possible at Coastal Physiotherapy, so that the number of treatments you require is kept to a minimum, which is obviously a more cost-effective way of treating any condition. Through the education process and teaching the exercises to do at home, this also reduces the risk of a recurrence of your injury.